All right, so now let's talk about history of audiology. Surprisingly, it's a very new field, new science. And the good news is, because it's new, there's still so much we don't know. Cochlea is quite a small, tiny structure, but it's a very privileged space, and there's still so many unanswered questions that clinically and in research, it makes it a very exciting field to be in. And Macquarie University is one of the 5 universities here in Australia to be offering this program. So if you want to study in New South Wales, which of course you should, Macquarie University is it. And we only have master's program, which is a conversion degree. So at the end of your master's degree, you can practice as an audiologist. What does an audiologist do? Anything that has to do with hearing and has an effect on communication is what an audiologist, I guess, play a role with. So it does have to do with prevention, it does have to do with diagnosis, management, anything that has to do with communication disorders and hearing, audiologists would be the ones to go to. We are certainly, I guess my favorite line about this is, audiology is a very nice mesh of science meets art. Science, because we deal with technology, we deal we have actually a short course on electronics as well, and calibration equipment. You kind of have to know that. But the focus is on people. And that's the arts bit, I suppose, in a very, very, I guess, wide, ambiguous sort of a way. But that's what you're dealing with. People with hearing losses. There are some, who knows or has experienced ringing in their ear anytime. Oh yeah, you should also come to audiology or to an audiologist, because that's one of the very, I guess, exciting fields to be in. We still don't know why it occurs, where in the auditory pathway it occurs. So needless to say, once again, it's a very new, exciting field to be in. Balance disorders. Who likes to go on those merry-go-rounds, the fast games, yeah? How many of you actually avoid them? You so need to know about the balance disorders, don't you? Once again, audiology is it. Okay, why should you study audiology, apart from it being very new, exciting field? Because, first of all, it is accredited, which means once you've got your degree here, you can work not only in Australia, but a number of countries across. It is a highly, I guess, any kind of undergraduate degree you have, be it in science or in arts, you are most welcome to apply to this program. Ours is a conversion degree. We prepare you to become an audiologist. We do have clinical program. It's a very heavily focused clinical program. So every semester you have clinical placements where you actually do hands-on or observation of what an audiologist does. Once again, technology, very big focus, but with a view on how it can help with people with a hearing impairment or a disorder. We do have a professional body that controls and in a way provides us with terms of what we can and cannot do. So Audiology Australia, and I would recommend anybody who's interested in becoming an audiologist, you certainly should go to this website and have a look on what the focus of the society, of the body is, and how it influences and plays a role. So that's the link over there. Now these slides will be available on our website as of tomorrow. So you certainly don't have to write that down. You'll have it available. In terms of, and that's a very popular question we get asked a number of times, what are the job prospects in the field? Most of our second-year students who haven't finished yet have a job. We've never had any concerns about finding jobs. We do have industry coming to us to talk to our students. Our students are picky and choosy, but that's entirely their choice, and they should monitor and negotiate about what they want to do, so which is great. But just to give you a perspective about the shortage in the world at this point, and this is my favorite example, may not be entirely appropriate, but 55 countries in Africa, 2 countries that actually train audiologists. The rest of the continent has no audiology representation. And that's just one continent. Regional Australia, big area that requires representation. So there's a big demand. Not so long ago, BBC actually stated audiology as one of the top 10 fields that were in demand. Okay, and why should you come to Macquarie? For those who are not from Macquarie, we actually have received, a few years ago, a federal grant that has enabled us to get a custom-made building for our needs, for our learning, teaching, and research needs. It's called the Australian Hearing Hub. That's being inaugurated next year, so the 2013 cohort is actually going to be trained in that facility. Apart from that, we've got the hospital here. We're building links with the hospital so you have more exposure and presentation of what occurs in a hospital setup. Cochlear is on board. They have their headquarters here at Macquarie, which is again presenting us a lot of opportunities for collaborations. Now, Australian Hearing Hub, great federal grant, but what does it mean for people who are coming into the program? And these are some of the themes. This Australian Hearing Hub is not just going to have the audiology and speech pathology in-house, but we actually will also have the industry partners in the same building. So some of the leading researchers in hearing are going to be in that building. And we are working towards making collaborations. We have them already, but as you can imagine, having them in the same space makes those collaborations much more tangible and certainly strengthens the relationship. The research facilities, at this point, we actually have to go off-site to be able to do it, but we've got custom, again, shielded, custom-made research facilities within Hearing Hub. The tutorials at this point that we run for hours and have to find space to run them, we actually have a room that's designed to hold practicum and tutorials, so you have more time and more, I guess, student as a tutor ratio. And I guess one of the biggest coup for us is that the clinic now is not going to be just audiology clinic or speech pathology clinic, but the clinic is going to be a collaborative speech and hearing clinic. So anybody, a child, as you can imagine, walking into the clinic who requires speech therapy but has a concern about their hearing, we've got all on that same site. So you can imagine you're going to get a very nice multidisciplinary approach to observe, which is great on paper, but doesn't happen very often. And of course, we're designing it so you're going to have a wider range of clinical services that you'll be exposed to. In terms of the student learning experiences, we provide the classes. We're not just the two of us. We have other staff, other academic staff, but we also invite other professionals from our hearing industry, but also other professionals who are required and kind of great to provide you with a overall view, a wide view on what intervention for people with hearing impairment means. We do have site visits allocated for students. Now, I thought we would introduce this video. For those of you who have not been on the website, this is by one of our students, and may actually tell you a little more than what just I'm talking about.
I'm Emma and I work at Cochlear in Sydney and I'm an audiologist. Hearing loss affects people of all ages all over the world, and the area of audiology that I work in is cochlear implants. To me, working in cochlear implants is so rewarding because to see a child hear for the first time when you switch on their implant and the difference that it makes to their life, it's just an extraordinary invention that changes people's lives. Another part I find really rewarding about the career that I've chosen is the bonds that you make with the other people that are in the industry. They tend to be really passionate about what they do, they love what they do, and just the families that you work with are so appreciative of the help that you give them that it just is incredibly rewarding. Studying at Macquarie really opened up a lot of doors for me. It allowed me to go into the career that I was really keen to go into. The other great thing about studying at Macquarie is that in the very near future, the Hearing Hub will have opened up, and the Hearing Hub is going to attract world-class researchers and academics in the area of audiology. It will just add to the experience of studying audiology on campus.
So I can say what all I want, but really coming from an ex-grad, I'm hoping that would convince you a little more about audiology here at Macquarie. Now, as I said, we have other academic staff who are not here, but will be there once it all begins for you. So Dr. Catherine McMahon, who's the head of the section, Mridula Sharma, that's me, Yvonne Stone, you met her, Rebecca Kim, John Newell, Philip Nickard. So these are our team, but we do have other clinical educators who are a part of our clinical setup where, as I said, you're going to be learning hands-on to apply what you learn in the classes to when you're working with your patients. Okay, one of the important things about the program, it is intense, and this is just to give you an introduction, but we do have the detail of the whole quadrant outside, so please feel free to take one of those so you can actually sit down and have a look at it. Our timetable does not really follow the university timetable. We start early, so we have a 3-day introductory workshop in the week of 18th of February, followed by 6 weeks when you have your lectures as well as pracs. Your lectures occur pretty much whole day for 3 days of the week, and the other 2 days you'd be coming in for 2 or 3 hours depending on what the tutorial or the prac is. Then you go away for your clinical preparation, and then you come back for you have 2 weeks of clinical preparation when you're coming every day for 2 weeks, where you're actually learning to put all that you've learned in your classes into being able to use in clinically. And then we send you off for your clinical placements, and we organize those for you. And then you come back for your exams. And that's the end of your first semester. Your second semester pretty much follows the same path. In terms of clinical placements, now this is directed by Audiology Australia, where we need to provide you with formal, intensive, relationship-based education and training that is case-focused. And when I mean what we mean by formal is that your clinical educator is a part and has almost like a license, but not quite that, to practice in Australia, and hence has the capability to supervise and help you with your clinical education. It is case-focused, which implies that you're going to be doing hands-on, you're going to be seeing real patients. And they're all of these are organized by the clinical coordinator. You have your placements in hospitals, private clinics, community health centers, non-for-profit organizations, schools. So these are organized by us. Clinical placements, they are structured in 1-week block, so you go away for the whole week. And you will have minimum of 2-week placements, so you're not going away for the whole 6 weeks, 2 of those within those 6 weeks. Where available, you may be able to attend placements in semester breaks if we need to. So this is a part of what you need and what we can organize. So it's a bit of negotiation over there. The placements will not just be in Sydney, but they are going to be regional. If you are from a regional place, we request you that you let us know so we can have at least one placement for you in the region of interest. The hard part is that the cost of these placements is yours. But we do try and help you in any way possible in finding out accommodation which is tried and tested and affordable. In terms of clinical place observations, now this is something we've introduced in order for students who are completely prospective students new to the field and would actually like to have experience on an observation of what an audiologist does. I'm hoping by the time you've come here, you already know what they do. But if you still would like an observation, if you go to the Facebook to our account and let us know, we can organize something to come over here to Macquarie, to our audiology clinic, and spend some time, I guess, watching an audiologist at work. Some important dates. 31st of October is when we close our applications, not the university, but this is for audiology. 1st December, we will start to give our first round of offers. 17 December is when we hope to get acceptances from the initial offers, and then 14th January, we hope to provide second round of offers, if they're available. And 18th February, as we said, we start our introductory work with our introduction workshop. These are the application details, my email and where I'm located and my phone number. So if you have any questions after today, feel free to contact us. But once again, 31st of October, which is both speech pathology and audiology application closing date. And that's what the Hearing Hub looks like. So that's not all of us there. We just have 2 floors. So thank you.